We're still in the middle of the outbreak of the coronavirus, but we're also starting to get into travel season with spring break around the horizon. Many have planned to head to warmer climates, but now are nervous and wondering if they should. In this video, we're going to talk about whether it's safe to travel and what precautions you should take if you are. Welcome to Family Med. I'm Dr. Richardson, and this is your home for practical and accurate information to help your family make healthy decisions. This is a channel that focuses on bringing better health to your home. We've been focusing on the coronavirus, just like many of you have been here at Family Med. We'll be giving updates along the way on this and other topics, so make sure you follow along with us here by subscribing and hitting that notification button so you don't miss out on the latest information. So today, we're going to be addressing whether it is safe to travel in this kind of environment, and how do you keep yourself safe if you are. There's a lot of anxiety that's being perpetuated through the media, and many of you may be questioning whether you should be traveling or not. This is a clear-cut answer, but we'll go over some different situations so that you can make a better decision for you and your family. It's important you understand as well that this is a moving target. There are still a lot of things that we don't know about the virus, and we aren't sure how far this is going to go. So far, at the time of this filming, this is still not a widespread virus, and no matter what, your chances of getting it are extremely low. Now, that doesn't mean you shouldn't take precautions. The first thing you need to do in deciding on whether traveling is a good thing or not is to look at the CDC's website for travelers. This is a great site that helps you understand what your risk is. I'll walk you through it, so come take a look. So what we see here is their site, okay? As you see, there's an interactive map for the whole world telling us which risk assessment by which country and what their precautions should be. As you notice here by the key, all these countries in gray are all places that we have a limited risk of community transmission. But there are other countries where there are some concerns. So as you look right here, turquoise, you have a sustained ongoing community transmission. Here in the lighter blue, you have widespread sustained ongoing transmission. And here in the dark blue, you have restrictions where you really shouldn't be traveling. Now as you look at each one, okay, we notice that, especially starting here in Japan. As you click on that, it tells you exactly what you should be worried about. It tells you that maybe you should consider postponing non-essential travel if you're an older adult or have chronic medical conditions. And certainly at any time you should avoid being sick around those people who are sick. You should wash your hands and take all those kind of precautions. Now as you step up a little more serious, let's go to South Korea. Okay, there is a widespread community transmission of the COVID-19 there. So they do recommend that, you know what, all travelers should avoid non-essential travel there. And certainly if you're older and have chronic conditions, you shouldn't go. This is the same thing with Italy. There's quite a lot of spread that's going on there. Same kind of precautions apply here. Now certainly in places like China, mainland China, as well as Iran, and I'm not sure why you'd want to go to Iran anyway, but those places you should not be going to, okay? And actually entry into those by US citizens is actually restricted. And if you do come from those countries, you have to be monitored in the United States for another 14 days before you can even go out in quarantine. Remember, this is an evolving situation though, so before you travel, make sure that you check this website and get the most updated recommendations. Remember, I'll put the link in the description below so you can refer to it later if you need to. So what about flying? Is that safe? Well, overall the answer to this is still yes. It's still felt to be safe. Because of how air circulates and is filtered on airplanes, most viruses and other germs don't spread really that easily on airplanes. Your biggest risk of getting sick on an airplane is if those directly around you are sick. But this is no different from any of the coronavirus and any other kind of sickness. So taking precautions such as trying to avoid those who are sick, washing your hands often with soap and water for at least 20 seconds, and using hand sanitizer when you can't wash can help protect you. Now we haven't been recommending that you walk around with a mask on during outbreaks like this because it really isn't effective in protecting you. However, when flying, having a mask available may be helpful if you happen to be seated next to somebody who is sick and actively coughing. So what about going on a cruise? Many of you may have had one planned for a while, and this is one that is probably making you a little nervous. And I don't blame you for this one. Cruises are a mode of travel that is ripe for illness and outbreaks. We see problems all the time on cruises with different viral infections. Most commonly, we see outbreaks with things like the norovirus, which causes a lot of intestinal issues. Going on a cruise automatically puts you at risk for an outbreak, just because of how many people are on the boat and how close everybody is. Right now, the cruise ship Princess is being held off the coast as passengers are being screened for the coronavirus. At least 2 of the cases of coronavirus here in the United States and our first confirmed death were linked to passengers who were on this cruise ship. So we know that cruises can put you at risk for getting an infection. So where does that leave you? Well, the risk of the spread right now is still low. Even with the cases linked to the Princess Cruise, you're still more likely to get influenza while on something like a cruise than you are the coronavirus. That being said, my biggest concern would be, because of all the precautions that are actively taking with everybody right now, you're more likely to get stuck on a cruise ship than you actually are at risk for getting the virus. That's right. My biggest concern is that you may be subjected to an extended cruise and confined to your cabin because somebody on the cruise came down with symptoms. To me, that just wouldn't be worth it. So, should you cancel your trip? Well, that's going to be up to you, but certainly, if you're elderly with significant chronic conditions, you may want to think about it more. The coronavirus does seem to affect that group a lot more. If you still do want to cruise, then make sure you're taking reasonable precautions. Avoid close contact with people who are sick. Avoid touching your eyes, nose, and mouth with unwashed hands. Wash your hands frequently for at least 20 seconds, and use an alcohol-based hand sanitizer when you can't wash your hands. And most importantly, stay in your cabin if you're sick, and let the onboard medical center know immediately if you develop a fever or have any other significant symptoms. So overall, travel to the majority of the places in the world is still safe. The risk of getting the COVID-19 infection with normal travel to unaffected areas is still very low. It's also important to keep the perspective that you're still much more likely to get and die from influenza virus than you are the coronavirus. So I wouldn't necessarily cancel all your travel plans. I would take some precautions though to keep yourself safe. Make sure you avoid those areas where the CDC has warned you from staying away from. Focus on proper hand hygiene, keeping your hands away from your face, eyes, and mouth, and staying away from those who are sick, and most importantly, if you're sick yourself, stay home. Now the funny thing about all these precautions is this is something we should be doing anyway. These are just good reasonable precautions that if we would all do, we would make a big difference in avoiding the spread of not only the coronavirus, but all the other seasonal illnesses that come our way. This is a rapidly evolving story though, and things certainly may change over time. So we'll be keeping an eye on it and giving updates along the way as things change. And so you don't miss out on any of our future content, make sure you subscribe and hit that notification button. And if you have your own questions that you'd like us to answer regarding the coronavirus or anything else, make sure you let us know in the comments below, and we'll try to answer it in a future video. And then until next time then, this is Family Med with Dr. Richardson. And remember to take care of your body, because it's the only one you have.